Hello everyone, welcome again to General Psychology, Psychology 101, and today we're going to briefly talk about personality. Now, in talking about personality, we're going to talk about many different theories of personality. We're going to touch on psychodynamic theory, humanistic theory, trait theories, and some social cognitive theories. So let's first talk about psychodynamic theories. So many of you are probably familiar with Sigmund Freud. He is the, if you were to ask anyone, name a famous psychologist, they're probably going to say Sigmund Freud. And he is kind of the flag bearer of many of these psychodynamic theories, specifically psychoanalysis. This is where most of our thoughts, our personality, for example, is driven by this dynamic between what we are currently thinking, our conscious, but primarily driven by our unconscious, things that are outside of awareness. A lot of Freud's theories focus on the unconscious, focus on repressed thoughts, repressed passions, these drives that we have and how they automatically and unconsciously influence our behaviors and thoughts. Freud outlined these three interacting systems, the id, the ego, and the superego, where the id represents our kind of naturalistic, animalistic drives. Our superego represents how we're supposed to behave in society, and our ego tries to balance both of these and help us behave in an appropriate manner. Freud outlines many different psychosexual stages of development, talks about how these can influence our relationships, especially with our mother and father. But most of our personality is driven by this interaction between the id, the ego, and the superego, and exactly how we are able to contain the id and how much of the id escapes and drives our behaviors determines what kind of personality we have. Some other psychodynamic theorists, specifically Alfred Adler and Karen Horney, focus a little less on unconscious, focus more on conscious, less on repressed behaviors. But they did focus on childhood social tensions and how they might drive personality formation. So children might develop an inferiority complex. If they're always having to answer to their parents, they might feel inferior or not as adept as their parents or maybe siblings. And Karen Horney specifically focused on a less masculine view of personality. A lot of what Freud focused on was this idea of how do we understand how men behave. It's because of their relationship with their mothers, their relationship with their fathers, etc. Horney kind of took a step back and took a look at the interaction between conscious and unconscious from a female perspective. And also we have Carl Jung. He focused on a collective unconscious, this idea that we have kind of an inherited or shared reservoir of memory traces from our species history. So all of us act on these similar unconscious thoughts that we have or unconscious memories given our ancestral history. So those are psychodynamic theories. What about humanistic theories? Well, rather than focusing on negative events from the past, which is basically what psychodynamic theories focus on, humanistic theories focus more on the positive aspects of personality, focusing on people who are healthy and how they behave and interact with other people, focusing on people who are trying to strive towards self-determination or self-realization, self-actualization. Some famous humanistic theorists are Abraham Maslow. We've talked briefly about the hierarchy of needs. Again, the final needs that are in this pyramid, this hierarchy of needs, are self-actualization and self-transcendence. The idea that we are able to fulfill our own potential and we somehow strive for meaning beyond the self. Carl Rogers is another humanistic theory, probably the individual who's most commonly associated with humanistic theories. And he focused more on person-centered perspective, having a greater focus on being genuine towards other people, being accepting of other people, and being empathic towards other people. So kind of promoting interacting with other people, promoting understanding oneself better. And the idea of the self is important to humanistic theories. The self-concept is extremely important, understanding who we currently are and who we want to be, our ideal self compared to our actual self. And the goal is to bring those two close together as possible, trying to make sure that we are striving towards this idealistic self that we have in each other. What about trait theories? Well, these theories primarily focus on ways of labeling or describing individuals. And oftentimes it focuses on different aspects of behavior that we can attribute to multiple people rather, or specific individuals. So focusing on behaviors that people commonly perform, identifying stable or enduring behavior patterns, identifying conscious motives that people might have. There are different ways that we can predict these different traits or personality traits that people might have. There's the Myers-Briggs type indicator, which most of you are probably filled out online, trying to identify, are you an introvert, are you an extrovert, et cetera, et cetera. These kind of dimensional different traits where you're either one or the other. There's no real in between. Extremely popular, but not really helpful in actually identifying personality. But most of the personality inventories that are used, especially within psychology, are able to identify relative focus or relative strength of multiple different personality traits. So the Minnesota Multiphasic Personality Inventory, MMPI, is one of the most common personality questionnaires or personality inventories that's used. Another big one is the Big Five Personality Inventory. These focus on openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism. The letter spelled ocean. It's an easy way to remember all these. But these 5 traits, these 5 personality characteristics, have been found across cultures, across nations, across ethnicities. They do appear to be relatively more or less involved or more or less apparent across the globe. And these are the 5 major personality traits. One thing to keep in mind with some of these trait theories is, yes, we can label people as having a certain personality characteristic or personality trait, but this can change. It can change from situation to situation. As we'll talk about when we talk about social psychology, the situation matters. So a person can change their behaviors, can change their way of thinking when interacting with different people or when in different situations. What about social cognitive theories? Well, these, again, try to take into account a little bit better the social context. This interaction between personality traits, stable personality traits that a person might have, and the social context in which people interact with others. There are certain concepts that are more important in shaping how a person behaves. So the idea of whether or not a person feels like they have control over their environment, that can influence how a person behaves or the personality an individual has. Whether or not an individual is able to control themselves, control delayed gratification, for example, that can influence the type of personality someone has. Some people have a learned helplessness. If maybe they've been in multiple situations where they just can't do anything, they can't control their own environment, for example, they might develop a learned helplessness. We do see some differences in terms of optimism. In general, being an optimist is great, but we generally see that people are more optimistic than pessimistic, and having a somewhat inflated ego or an inflated self-concept can be extremely beneficial and can lead to a lot of positive psychological outcomes. So one thing important that I want to mention before we finish is the concept of the self. And the self is kind of a tricky construct to understand, a tricky idea, and we don't really have enough time within an introductory psychology class to get into the self. It's very complicated. But generally, the self is considered kind of the organizer of a person's thoughts, feelings, and behaviors, and it's believed to be the center of personality. We can have different selves that we might utilize in different situations, so it might be different roles that we might fit into. I might have a teacher self and a father self and a husband self. Each of these are different, have different personalities. We can have ideal selves and actual selves, or ought selves, the selves that we think we should be. And how we kind of evaluate ourselves is known as self-esteem. These feelings of whether or not we are worth anything, feelings of self-worth. Self-esteem is also a great thing to have, along with a positive self-concept. Better life outcomes, better health outcomes occur for people who have high self-esteem. Extremely high self-esteem can be bad, but that isn't very common. Just having simply high self-esteem is normally a good thing. And we tend to focus more on the self, or give ourselves the benefit of the doubt more than other people. We tend to take credit for successes. We divert failures to other people or the situation. We tend to see ourselves as better than everyone else or better than average. If everyone sees themselves as better than average, that's not possible because of the way math works. And we tend to see ourselves in a better light than actuality. For this reason, we tend to have an inflated view of the self. And if we truly want to understand ourselves at an objective level, we're better off asking someone else about ourselves than looking inward. So that's all I have for today. Thank you for your time and attention, and I will see you all next time. Bye-bye.